Thank you for your story. We all have stories about the miracles of birth. I have my own, as do probably many people in here. I'm a mother, I'm a grandmother. I value life. My pregnancies I was very grateful for. My children and grandchildren I'm very grateful for. It doesn't always work that way for everybody. There have always been abortions and there always will be. What we're talking about here is some specific actions that would be taken to obstruct access to a legal medical procedure. So I want to ask you a few medical questions, if I could, please, about the provisions in the bill that bans abortions at 6 weeks gestation. Can you tell me your own interpretation of the timeline in which a woman can determine that she is pregnant?
Representative, this bill would ban an abortion once a heartbeat is detected.
I understand that. I'm asking you, though, about about the timeline, because you're giving us a period of time within in this bill, are you not?
The timeline is when the heartbeat is detected.
Okay. All right, then let's just go with that for right now. Can you tell me what is meant by gestational age? How is gestation defined?
Yes, I'm happy to turn to the definition. Under section 171.201, gestational age means the amount of time that has elapsed from the first day of the woman's last menstrual period.
And do you know then what the differences would be if we were looking at the period of time of pregnancy versus the period of time of gestation?
I'm not sure I understand your question.
You just finished saying that gestation is measured from the first day of your last menstrual period, correct?
Under 171.201, gestational age is measured as the time that's elapsed from the first day of the woman's last menstrual period.
That's what I just asked, correct?
Yes.
So from the first day of the last menstrual period. Do you know when you actually become pregnant? Do you become pregnant during your period?
Well, that perhaps might be a question better directed to a physician.
I would imagine that most women know that you don't get pregnant during your period, correct? You know that you don't get pregnant during your period, don't you?
I would defer to a physician to answer that question, Representative.
So typically your period is the sloughing off of the lining of your uterus containing an unfertilized egg. Is that correct? Do you know that?
I would agree with that.
Okay. So your body is removing the blood, the unfertilized egg, and you are having your period. That's getting rid of what did not get fertilized. You're not getting pregnant at that time. And then over the next couple of weeks, you ovulate, and then you can get pregnant. Is that something you've probably heard before?
I'm familiar with ovulation. I'm familiar with menstruation.
Okay. So I think where we're going with this is to look at the amount of time that would be elapsing from fertilization of an egg to pregnancy to when this bill would take effect. Now, you're telling me there's no time. Is that correct? You're telling me there's no time here. There's just a point at which you hear a heartbeat. Is that correct?
Yes, I'm telling you that the measurement is by a detectable heartbeat.
Is there no reference to time in the bill? To point of gestation?
There's a definition of gestational age.
Right. But I'm asking you, is there anything in the bill, and I don't have the bill in front of me right now, so I'm seriously asking you, is there anything in the bill that provides a point of gestation at which this bill would take effect?
This bill is
Is there anything about gestation?
There's a definition of gestation. There's a definition of pregnancy.
Mm-hmm. Where is it?
But I'm not sure where you're looking.
Well, no, I see the definition here. What I'm asking is, so you're saying that there's nothing in here in the bill about gestation. There's only something about a heartbeat. Is that correct?
We are measuring by the existence of a heartbeat.
Right. You're not measuring by anything in gestation. Is that correct?
We are measuring by the existence of a heartbeat.
I understand that. I'm asking you, are you also measuring, though, by gestation, yes or no?
I am measuring by the existence of a heartbeat.
Can you not answer that second question?
I am answering it, Representative.
Okay, I'll just take that what you're saying is no. Okay, so if we're only talking about a heartbeat, at what point in gestation does the heartbeat normally occur?
It varies. Mm-hmm. My understanding is somewhere between 6 and 12 weeks.
6 and 12 weeks gestation?
That it would be detectable.
So your understanding is that 6 to 12 weeks gestation, a heartbeat is detectable?
Yes.
So would you know that 6 to 12 weeks means 4 to 10 weeks of pregnancy? So as early as 4 weeks pregnancy, you're saying there could be an audible heartbeat?
I don't know that I am saying that. I'm saying that between 6 to 12 weeks.
Gestation. Yeah, and in your bill, pregnancy is defined as when it begins with fertilization. That fertilization is not the same as when gestation is measured from. So, I mean, we're talking two different time periods. I'm just clarifying what those time periods are right now. Gestation is from the first day of the last menstrual period per your bill, and that's what medicine says as well. That's a common term. And pregnancy actually occurs beginning at fertilization, which typically occurs 2 weeks or so after your menstrual period. And you have those definitions in here, in your bill. So
yes.
If you're telling me that...
Gestational age and pregnancy are defined in the bill.
I'm sorry?
Gestational age and pregnancy
right, and that's what we're talking about here. Gestational age from the first day of the last menstrual period, and pregnancy is, as your bill states, begins with fertilization. Fertilization occurs approximately 2 weeks after your menstrual period. So, when you're talking gestation, and you say 6 weeks when you could hear a fetal heartbeat, that's actually 4 weeks of being pregnant, basically, on average.
I'm not sure I agree with your math.
Well, what does your bill say? Your bill says pregnancy means the human female reproductive condition that begins with fertilization.
Occurs when the woman is carrying the developing human offspring and is calculated from the first day of the woman's last menstrual period.
Oh, that's not pregnancy? Why do you, no, that's not pregnancy. That may be what you have in your bill, but that's not pregnancy. Pregnancy begins with fertilization. Fertilization and menstrual periods are two separate things. They don't occur at the same time. But that's just an error in your bill. But if we're going to, let me just talk about the time period we're talking about here, and you're telling me that there is an audible heartbeat as early as 6 weeks gestation. That's 4 weeks being pregnant, but let's just go with gestation. 6 weeks gestation, there is an audible heartbeat, you're saying. Is that correct?
I'm saying that a heartbeat is detectable
as early
somewhere between 6 to 12 weeks of gestation.
As early as 6 weeks gestation. Correct?
Somewhere between 6 to 12 weeks.
Right, or as early as 6 weeks gestation. That would, between 6 to 12 encompasses as early as 6 weeks. Correct?
I'm saying that the heartbeat is detectable somewhere between 6 to 12 weeks of gestation.
Right, starting at 6 weeks gestation. That's what you've said. Would you know that the American College of Obstetricians and Gynecologists has said in a statement, what is interpreted as a heartbeat in these bills is actually electrically induced flickering of a portion of the fetal tissue that will become the heart as the embryo develops. Thus, ACOG does not use the term heartbeat to describe these legislative bans on abortion because it is misleading language, out of step with the anatomical and clinical realities of that stage of pregnancy. Did you know that?
I am not aware of the article you're referring to.
I'm not referring to an article. I'm referring to a statement from the National Association of College of Obstetricians and Gynecologists, the physicians who specialize in maternal health and who actually have the background in science in this field of study. So that's who I'm referring to. Did you know that it's difficult, according to these physicians, to detect the embryonic heart, any kind of a heartbeat, if that's what we want to call it, the early cells with electrical activity, but not heart. There's not actually a heart yet. Did you know that? There is not a developing heart. There are no chambers. There's no blood pumping going on at that time. Did you know that?
I don't know that I agree with that.
Well, that's what the science says. And that a true heartbeat that you could actually hear, according to the physicians, a true heartbeat that you can actually hear with a stethoscope, doesn't occur until later in gestation. 80% of pregnancies, you can finally hear it audibly with a stethoscope after 20 weeks gestation, and 100% of the time after 22 weeks gestation. So clearly it's much later than what you're suggesting is the time frame in which a heartbeat, as you're calling it, would occur. Did you know that?
I disagree with that.
Why do you disagree with it?
Representative, just based on personal experience, having heard a heartbeat much before 20 weeks of gestation.
According to the science, the Doppler fetal monitor that has that sound that you gave us a while ago is not actually the sound of a heartbeat, but an amplified version of signals. You're not hearing a heartbeat. You're hearing an amplified version of electrical signals. Did you know that?
I'm sorry, would you repeat the question?
Okay.
My apologies.
The Doppler fetal monitor, are you ready?
Doppler fetal
monitor. Doppler fetal monitor, you're not actually hearing the sound of a heartbeat because there's not a heart beating, but you're hearing amplified version of electrical signals. Did you know that?
I fundamentally disagree with that.
Well, I appreciate that you don't want to believe this and that you are disagreeing with it, but I'm talking about what the science says, and so you're telling me that the science is wrong because you don't agree with it?
What I'm telling you is that when a beating heart represents a life within a womb, we have a duty to protect that innocent unborn life.
And I appreciate, excuse me, Mr. Speaker.
Members, we're not going to have displays on the House floor. Please contain it.
Thank you, Mr. Speaker. Thank you.
You're welcome.
There is no heartbeat at the time frame that we're talking about here. There is electrical activity. That is a fact.
Representative, I've had a lot of ultrasounds and they never once referenced an electrical impulse. It was measured in beats per minute.
I'm sorry, I'm just telling you what the science says, and I can't say what you've been told. I'm telling you what the science is. Now, this is the final thing I want to say before I pass it on to others. There is no arguing this because clearly we all know we're talking.
The lady's time has expired.
Mr. Speaker, may I move to extend the time?
Members, you've heard the motion. If objection, chair hears none, so ordered.
Thank you, Mr. Speaker. I see lots of notes being passed. I'm sure a lot of people up there have a lot of things to say about this too. We've had this discussion way too many times since I've been here. This is the worst day of the session, every single session, and this stuff keeps coming up. You guys know that there have always been abortions and there always will be. Despite the obstructions that you're putting in place here, despite the self-righteousness of valuing life over what I value, which I highly resent, I also value the lives of the women and families who have to make these decisions.
This is the best day
I was
for
still
tens
talking.
of thousands of unborn children in this state.
I'm sorry? I didn't
Do
hear
you have a
because you talked over
question,
me.
Representative?
What?
Do you have a question, Representative?
I will phrase it in a question. Did you know I feel this way? Did you know that I feel very disrespected in terms of my value of life and my value of pregnancies and childbirth and babies and grandbabies? There will always be, did you know, there will always be women who will pursue having abortions despite what you do here today and what you've been doing for a decade to create all these obstructions. It will always be a case that women will seek abortions because women are not always in a position to have that baby, and you guys don't have to have them. We do.
Did you
affects
know,
our
Representative?
lives. It affects, did you know?
You're asking me a question.
Did you know that
May I
it
answer
affects
your
my
question?
choices about what I can do with education and employment? You
If
didn't
you're
know that?
asking a question, are you going to allow a response?
What's your response?
I don't presume to know your feelings, but I do know that there are many women who have been coerced and forced into abortions and feel very differently.
Well, that's one thing that I will not agree with of you. So I will pass it on to some other folks.